is Laura Kyttanen. I'm a lifestyle blogger giving you a taste of my life as a wife, mom, and sensory branding and marketing consultant. One of the things that I do on my blog is feature lady bosses. I love to empower other women and to showcase what they're doing. And today I am featuring Dr. Hadian, not only because she's an amazing lady boss, but also because I have chosen to go down the Invisalign path again. It will be my second time, and I want to share my journey with all of you to inspire you to keep good teeth. So thank you so much, Dr. Hadian, for being here. Please introduce yourself.
Thank you for having me on your show. I'm Dr. Hadian, and we're at Chic Dentist today. This practice was established with me and my husband, who is my life partner as well, Dr. Sadri, in 2008. We both are USC graduates. We have two daughters who are 5 and 9, and we absolutely love what we do. We're pretty passionate about smiles and people, and this is like a perfect place to bring it all together.
Great. So we're going to have a little interview, and then I'm going to take you into behind the scenes look at my process. Let's get started. When did this dream happen for you of becoming a dentist? Like, how old were you? How did the dream start?
I believe I was 5, and I used to, when the pretend play begins, and I was always playing doctor. Whoever would come to our house, I wanted to give him a shot for some reason. Very odd, but and then by the time I was in 3rd grade, I knew I'm going to be a dentist. I just found teeth very fascinating, always, like the whole smile and the connection. I feel like it's your when you look at someone, that's like the first thing I see, obviously, but I've always thought we carry a lot of our confidence through our smile.
Yeah, absolutely. And what have been the things that you've seen sort of kind of like advance the most in terms of technology and so forth?
Well, dentistry, more than any other, I feel like field, has grown in the past 15, 20 years. Invisalign itself, like up to a year ago, I believe it was like maybe 1 million, 2 million, and this year they hit 5 million. So you see how much awareness and how people are more mindful and more into like preventing. People are definitely, I think the attitude is changing. Before dentistry was more like a pain driven practice, like people would not go see their dentist until something was hurting, and it would be like an extraction or root canal. Now it's like, make me pretty, make me feel good. I want to have healthy teeth. I want to have beautiful smiles. So the attitude has definitely changed, and I feel like there's a lot of amazing technology behind it all. That
I know we're going to take you guys through a behind the scenes look of what that is for Invisalign, and you're going to actually see my before teeth, and then you'll eventually see my after teeth. But I was impressed with that process changing so much. The way that you took my photos this time, and how it could be sent off just so quickly, I was just like blown away by that.
Because you've had an experience. How many years was that?
It was like 10 or more
10 years ago. And now after 10 years, I'm sure they put a bunch of material, gooey material
and
together.
I had to bite down, and then this thing came out of my mouth, and they had to send it away, and it was really just awful.
We have choked many patients. I'm kidding. But now with the scanner, we just basically go in less than 3 minutes. We pick up the impression of your teeth, and less than 15 minutes, Invisalign receives it.
It's
and
amazing.
Less than 24 hours, we have a treatment plan for you.
Yeah.
The technology has just taken dentistry to a whole different level.
This is a big one, because I see you as working with your partner, you're a mom, and you have this pretty demanding job. So how do you find balance in everything? One of the things you wrote on my blog, and we're going to be featuring that article as well, 3 tips for other women, and one of them was keep working no matter what. After children especially, they need to see that you're doing what you love. And
absolutely. I'm a big believer, and I'm always encouraging my friends who I went to school with. I'm like, don't give up your careers, because we have worked so hard, and it's such a big part of who you are. That and I feel like when my girls see me in the morning in my scrubs dropping them off, and then I go pick them up. I do balance by scheduling my schedule. I'm very fortunate that I have my own practice and I'm capable of doing this. It's very empowering. It's very encouraging. You know, there's like I was teaching my daughter the other day, impossible. I'm like, the word itself says I am possible. So there's nothing. I mean, I feel like we can do it all. We've been given the power to do it all, especially in this age and time. And we should take advantage. It makes me definitely, I love the days I work. And I get more done on those days than my day off, which is funny? Hilarious to me. I'm like, how did time just pass by?
One topic that's very near and dear to me is working with your husband. There's a lot of, you know, excitement to that. There's a lot of challenges to that.
There is, and we love it. It goes up and it goes down and it goes up and.
Yeah. What is the one tip you would give?
As far as working together, be flexible.
Okay, that's fair. I've had to learn how to do that. So when I posted about this interview, there was big questions around how I made a statement how our teeth shift during pregnancy, because you mentioned to me about the calcium and things like that. So people were like, oh my God, I didn't realize that. Can you just share like high level top things to really think about for all my pregnant women out there during pregnancy, for both them and for their babies?
No, absolutely. I mean, everything shifts. Your body grows, and once your body is growing, your organs are moving. Everything is moving, including your teeth. And I feel like if your pregnancy is planned, the best thing to do is make sure you have no cavities. Make sure your gums are in a healthy space, because if things are in a great place, then the pregnancy, you're just monitoring it. It's not going to get worse. But if you had ortho and you don't wear your retainer throughout your pregnancy, for sure you're going to have a relapse. Yeah. I was one of the relapse patients myself, and I had to get Invisalign after my first daughter. So the retainers are a big part of it. And then getting 2 checkups during your pregnancy. Make sure, like right before you deliver, especially because you get so busy the first 6 months with having a new baby, that you forget about your own health. And you know, everything we eat and we feed our baby goes through our. This is the entrance to our body, so we got to make sure it's always healthy and in a good condition.
Here's an unusual question for you. How would your life taste like right now?
As far as just
anything, the first thing that comes to your mind.
I'm in a very good place right now. I feel like my kids, I drop them off at school, so it's pretty awesome. It's very playful. I love my career. I love the ages of my daughters. They're like so much fun at this. So everything, you know.
So it tastes sweet, or
it tastes very, yes, I would say very dolce.
Before we go into showing people how the process is going to look, I want to do a bonus question with you from a deck called What's Your Word? It's from myintent.org. So you're just going to pick one, and then I'm going to ask you. You can read it.
Would you dream of achieving one day? Ooh. Being in Saint-Tropez on a yacht with my bikini, with my girls and my husband.
Oh, I can get along with that one.
Yeah?
Oh my God.
Would you come and see me?
Yes. Absolutely. So this is the machine that you use to start the process, and I was amazed with how fast it went.
So this is iTero. I call it my magic wand. I scan the teeth anywhere from 2 to 5 minutes, and when you come for your consultation, you have a chance to see your before and after within minutes.
So cool.
It is super cool. It's super easy to understand the process and also see the before and after. How you guys can see here, we're expanding the top teeth to bring a better balance in her occlusion, and also aligning her front, pushing them back. And this is the lower, where same thing, we're expanding and bringing the front out, and this will be the final, where from a very deep bite she goes to a normal, desirable, healthy bite.
Exciting. So you're going to get to go on the journey with me, and I'm excited. I hope that you enjoy watching the process of my Invisalign, but also that you learn something from it and leave us any questions along the way so that Dr. Hadian can answer them. Thank you so much, Dr. Hadian. This has been so fun. I'm excited to take you guys on my journey, and thank you for watching and to continue to follow us. Stay tuned.